Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
I want to get to our next question here. Actually, I'm so bad. I need to get to this question. I can't believe I didn't get to this before. Hello, ladies. I would like to ask for help with my son who just a few weeks ago started having intense behaviors, which include doing rituals like tapping on things, going back to step on the floor, running towards the door of the house, running to the kitchen wall. He's also crying out of nowhere, screaming, asking for help, saying things like, "Don't take me," and "I don't want to die." When my husband or myself try to stop him from doing some of the rituals, he becomes aggressive towards us or himself. I'm not sure where all this behavior came from, but it all started around Christmas time. Prior to the behavior starting, he had a dental procedure to remove 2 baby teeth that were not coming out on their own, and adult teeth were already coming in. The experience was traumatic. I lost my place. They had to strap him down because he was trying to hit. He had never had a procedure like that done before. The whole time, from start to finish, he cried, screamed, and asked for help. It was the most traumatizing day, I swear. I feel like all these behaviors started the day after the dentist. He has never had such rigid behaviors before. He seems scared and super anxious. It almost looks like he has panic attacks a few times a day. I asked him the other day, after he had somewhat calmed down, why he was squeezing his head. And he replied that he heard a chin-chin type of sound and that he wanted to touch his brain. He also added that he couldn't put his body back together and that there were a lot of sick people dying. Please help me. This is a really terrible seeing him. He looks like he's so lost and almost like he can't control his body or his brain. Please, I don't know how to help him, and I don't know how much longer I can see him like this. Thank you so much. And she did leave her phone number. So, yeah.
So this is, when you first started describing some of the things that he's doing, like running back and forth and so on, I started writing down for myself anxiety behaviors. And this is more than just normal anxiety, this is trauma. So he experienced trauma, as you mentioned, and what he's experiencing now is PTSD, which stands for post-traumatic stress disorder. Very clear. You described PTSD completely. I mean, exactly. And, you know, different people have different, levels that they can tolerate, tolerance levels, right? And someone might go to war in Vietnam and come back and not have PTSD, and someone else might develop PTSD from having a dental procedure, especially when it's a child who doesn't quite understand what is going on, and it's a painful, and maybe they can't express that or whatever it is. It doesn't matter, and please don't blame yourself for that. You did what was right, and you had to get him through this, because we all know that dental pain in the long run is also very, very traumatic. So what you did was fine. Where we are now is PTSD, and we have to deal with it. And with PTSD, the problem is that it is so severe that oftentimes, initially, behavioral stuff doesn't work all that well because the individual is just traumatized, right? And they're not open to receiving. So it's kind of like if I was to tell you, you know, try to reward him more. It might work and it might not, because at this point he is so traumatized that he's just doing all of these things. And by the way, you know, anxiety behavior or stuff that we do post-trauma is all protective. It doesn't make any sense. It's not logical, but it's what our body and our brain does in order to protect itself. So like people who have obsessive compulsive disorder, for instance, they wash their hands, as an example, 50 times. It's not logical because you just washed your hands a minute ago, right? But it is the process of what goes on in the brain. The compulsion is calming. And so with your child running back and forth, that compulsion is calming. These types of illogical, repetitive behaviors allow the individual to feel like they have control over the situation. And by doing this thing, they're getting control over it. They're going to be okay. They're going to be safe. And so that's the psychology of it. Just to understand that it's pretty hard for you to see these things, but that's what it is even if he's hurting himself or hitting or scratching or whatever it is, it's I want to get control over whatever this feeling is, and this is one way that I can get control over it. Okay, so what do? We basically go back and you will start with getting medication. And once you get medication that will help him calm down, and again, we're talking about anxiety medication. And this does take a couple of weeks, but it's relative. You could even get, your pediatrician might actually even be willing to give you, a panic type medication. So these are medications that are usually not used a lot with children, but in trauma situations they are. And what they do is they give you, it calms you almost within 15 minutes, right? It's not intense, but it calms you in very quickly so that you're not panicking. Now, it might also make the child a little bit tired, let's say. But regardless, once you have calmed the child, then that's where you do a lot of the activities. Like, for instance, you will take a look and see, let me ask you as a parent, can you segment his day and observe when these behaviors are happening more? Are they happening equally across the entire day? In which case, we will now need to put in a lot more calming and rewarding activities throughout his day. Or are these behaviors happening at certain times of the day? Perhaps when he thinks you're about to take him out. Perhaps it's when he thinks that you are, I don't know, it's the afternoon and he's tired. Maybe he's not sleeping. Like, when are these behaviors occurring more? And what you do is you essentially start to completely alter his entire day. So you'll start with we're gonna have Disneyland every day. We're gonna do only things that are super, super, super fun and positive for him. Things that during which he would never hit his head or do any of these other things. We're gonna have fun. So now we're having an absolutely fun day. That's good, but how long can I keep this up? Don't worry about it. You'll keep it up and you'll gradually change it back to normal. But the bottom line is he went through trauma. So right now you have to make everything turn positive again before you can gradually go back to just normal routine. So, behaviorally, that's the way to go. You start with a fully reward enriched schedule, and you gradually reintroduce demands, very gradually, so that he can handle it. That's the behavioral. In terms of the medical, aside from looking at things that would help anxiety, you also want to, by the way, track his sleep, because his sleep might have been altered, and if your sleep is reduced, then you're going to have more anxiety during the day as well. So these are some pointers, but trauma is a very odd thing, and getting over it takes a little bit of time.
Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.